I'm Kedar Kirtane. I'm the Medical Director for Solid Tumor Cell Therapy at Moffitt Cancer Center. And I'm reporting here from Cell Coast 2024. I have Dr. Michael Poch, urologist in the Department of Genitourinary Malignancies. Dr. Poch, can you tell us a little bit about your intravesicular TIL?
Sure, I'd be happy to. So far, we have a clinical trial that's open, sponsored by the DoD, where we're treating patients who are BCG exposed, so prior BCG therapy, who have recurrences in the bladder. We're harvesting those tumors, and then we're growing out the TIL and then redelivering it into the bladder once a week for 4 weeks, about 320 million cells per week. So far, we've treated 4 patients. We're in the middle of treatment for patient number 5 with very promising results. We're liking what we're seeing in terms of early results, in terms of recurrence-free survival in 3 months. So far, we've got about a 50% response rate.
That's really great. We have maybe a better idea of systemic TIL products and their toxicities. What are some intravesicular TIL toxicities that you have seen or would expect?
It's actually pretty minimal because we don't have to do the lymphodepletion that you typically have to do with the systemic therapy. Really, what we're seeing from toxicities is pretty minimal. We see some patients who have bladder spasms associated with delivery of drug, but the reality is that we're not seeing the risk of CRS syndrome. We're not seeing the bone marrow toxicity that you may see with lymphodepletion or high-dose IL-2. So it's actually been really well tolerated from the patients.
And how do you ensure that the TIL product stays in the bladder for the time that it needs?
So typically, patients are getting a catheter and the product is getting delivered through the catheter, and they keep the catheter in. So having a catheter in your bladder with a balloon sort of leads to a little bit of obstruction, but also prevents the TIL from leaking. And then we actually give patients antispasmodic medication to prevent bladder spasms from occurring to try to keep that product in.
Very nice. And how many patients do you intend on treating on the trial?
We're trying to get up to 9 patients for our phase 1 trial here. We have sort of room to go up to 12 if we can. The idea is that we may have some screen fails associated with it, so that is sort of built into the trial.